ladies and gentlemen, remember to fear the beard. Not only fear the beard, but you listen to the beard, the great Nick Somberg. Nick, come on down.
Wow. Thank you. Well, thanks everybody for having me out tonight. Just wait for my PowerPoint to go up. So while it's loading, as you know and may have heard, we have a new pilot program going on in Michigan where in 6 different counties across the state, they're going to be testing out roadside drug testing. This is going to be in the form of a cheek swab, and they're going to be able to test your DNA, your blood, and to be able to see, have you done drugs, ever, or in the last week. Go to the next slide, please. Now, they're developing this program. I mean, guys, marijuana is going to be legal very, very soon. And the state knows this, but the state can't let their revenue stream go out the window, right? Uber and Lyft, drunk driving is way down. They need to make their money, and they need to pull people over and get people in the system. So we're going to go over more of the specifics to this. This is a quick presentation. I'm going to be here after if you want to talk to me and ask more specific questions. But please, next slide. So this was established by Public Act in 2016, and it was to determine whether an individual is operating a vehicle while under the influence of a controlled substance in violation of Michigan law. This is a 1-year program that began in November 2017, and it lists the counties. We have another slide with all the counties. Basically, a police officer who's trained as a drug recognition expert are the only police officers that are allowed or trained to administer this type of test. How they pick these counties were they look for the counties where there's traffic stops and arrests as a result of drug use. Also, where there were traffic crashes and fatalities, where people in those counties had some sort of Schedule I drug in their system. So this pilot program is going to be going on for 1 year, and they're going to see how it goes, and then we might be lucky enough that they're going to be doing it across the state of Michigan in every county. So next slide, please. These are the counties. We are lucky enough that it's nowhere in Oakland, nowhere in Macomb, but if you travel up north to the UP or St. Clair County, if you go on the water, you got to watch out for this type of thing. Next slide. Okay, so the law. A county participating in roadside drug testing program so a police officer must have reasonable cause to believe that a person was operating a vehicle upon a highway or other place open to the public, including parking of vehicles, blah, 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 and that they may have consumed a controlled substance which may have affected his or her ability to operate a vehicle. So I underline reasonable cause. This is not probable cause. Okay, probable cause is they come up and your car smells like marijuana blatantly, or there's drugs in the open, or you admit to it. That is probable cause in itself. This is just reasonable cause. So this gives officers a lot of discretion. So if you're just tired, if your eyes are watery or really anything, an officer can say, hey, I have reasonable cause to believe that you are under the influence of a Schedule I narcotic, and therefore I can do this cheek swab on you. Now, a Schedule I narcotic, it's literally, I wanted to copy and paste it, and it would take up like 10 slides. It is so many different drugs the government says you are not allowed to put these substances in your body with all sorts of, it's all sorts of chemical long names. You wouldn't even know what they are. But go to the next slide, please. I put this in there not to go too far off topic, but what is Schedule I substance? The DEA defines Schedule I narcotic as a drug with no currently accepted medical use. And this is a screenshot of the United States patent for their medical use of cannabis. So we have a blatant hypocrisy here. You would think that, well, why doesn't some lawyer, sue and say, well, here, it has a medical use. You own the patent. But it unfortunately doesn't work that way, and I'm not the first person to notice that. And unfortunately, we have a system that keeps their money scheme in place so well. Next slide, please. So it can't just be any police officer. It has to be a police officer who is a drug recognition expert, okay? and a peace officer, police officer, peace officer. And we're going to go into what a drug recognition expert is. If you go to the next slide, please. What is a drug recognition expert? Well, you could say, hey, you know, I lived through the 60s, 70s, you know, I'm a drug rec. I can recognize, you know, I know when my kids are coming home, and no, there's an actual real official class for all of this. Next slide, please. So, a drug recognition expert means a law enforcement officer trained to recognize impairment in a driver under the influence of a controlled substance rather than or addition to alcohol. So there's a whole alcohol class, there's standard field sobriety tests. So this is in addition to that. This is the top tier of the OWI pyramid, as they call it. It is advanced training for highly motivated officers. This is from the Michigan State Police website, by the way. I didn't write this. It is training for advanced training for highly motivated officers active in OWI enforcement. So people are highly motivated to, you know, maybe raise revenue for the state, to have more victimless crimes. DREs are police officers highly specialized training that allows them to identify impaired drivers by drugs. So what is their training? It is 40 hours, and it consists of 3 phases. Phase 1, phase 2 involve, 72 hours, 2 weeks of classroom, lecture, and hands-on instruction. Phase 3 involves 40 hours of field training, during which officers are required to perform evaluation on subjects known to be under the influence of drugs. So the police drug people voluntarily, I guess that's okay. And then they get to practice determining who is on drugs. Did you
ask questions at the end?
Yeah, please. Sure.
Who pays for this training? Federal grant?
I don't know if it's a federal grant, but I mean, the people, you know.
Taxpayers, eh?
The taxpayers.
Well, thank you.
Okay. So there's a procedure to this. They don't randomly pull you over, and if they do randomly pull you over, you know, the whole stop, you could have a dead body in the trunk. If you're not pulled over for a legal reason, all evidence is excluded. So it's not random, but once they do pull you over, they're going to be looking, or if they're following you, we'll back up. They're going to be looking for certain things like weaving, driving too fast, driving too slow, not using your turn signals, indicators, pretty much anything. I mean, your average person driving, you commit civil infraction every minute. After making a traffic stop, police have to establish probable cause for impairment. That's just for a blood draw, and that's Lieutenant Jim Flegel in an interview I found with MI Live. So the reasonable suspicion standard is just for the cheek swab. Okay, to take your blood, they have to have that probable cause standard that basically you admit, yeah, I use drugs today. Or they find it blatantly in the car. It's the same thing for a DUI. There's implied consent laws. Once they have probable cause that you are under the influence of alcohol, you cannot refuse a blood test. So it's basically the same thing, but now they're wildly expanding it, not just alcohol, but a list tremendously long of all different sorts of substances. Next slide, please. Okay, so the most common question I get is, well, do I have to do this? What are the consequences for refusal? The consequences are the same for refusing a PBT. So if you're driving and if there's a question, well, should I refuse a PBT? If you refuse a breath test, that is a civil infraction. So it's the same consequences for that. Civil infraction, meaning it's not a crime, there's no jail sentence, there's nothing like that. It's going to cost you money. And depending where you get pulled over, the different courts have different fine schedules for their civil infractions. If you refuse the blood test, now that's a misdemeanor, that you can lose your license. It's the same thing as alcohol. There's a little bit of difference if you're driving a commercial vehicle. However, if you're driving for work, if you're a trucker, mover, whatever, if you refuse that cheek swab, it is a crime. It is a misdemeanor, punishable up to 93 days in jail. So my advice, if you're not sure of whether or not you should or not, it's better to refuse. Due to the fact that refusal merely constitutes a civil infraction. Another point, which I have a slide on, if you have a medical marijuana card, that allows you to drive with a detectable amount of marijuana. So I'm going to get into more how, I think, go to the next slide, please. So just indicating how serious this is. I actually have a client going on right now where he had, I think it was like 8 nanograms. Okay, so if you've never smoked marijuana in your life, if you smoked a week ago, you're going to have some sort of nanogram level in your blood. Now, people, we have DUI laws as public policy. Well, yeah, you're driving, you're impaired, you're endangering people, you get a DUI. This driving under the influence of a controlled substance, they called it is strict liability. If they test your blood and there is a 0.1, you smoked a week ago, it is the same as a DUI. It is a misdemeanor. It is points on your license, suspension, revocation, expensive fines, everything. And it's completely unfair. A lot of lawyers talk, we talk about this law where, when you're representing someone in a DUI, you go to a jury trial, it's like, well, the police or the government has to prove impairment. They have to prove, well, okay, you were a .08 or whatever, and you were impaired, you were swerving or whatever. This is completely just strict liability. If there is a nanogram of THC or any other Schedule I controlled substance, hundreds of them, you can get a DUI based on that. These are the jury instructions. If you went to trial, all they have to prove is that you are operating a vehicle. That's going to be easy. That you were on a highway. Either you were or you weren't, public highway. And then bullet point 4 is the most important. The defendant had any amount of a Schedule I or II controlled substance. Any amount. So other than challenging a blood test as not accurate, I mean, it's wrong. And it's wrong because it's making criminals out of people who aren't driving impaired. You are not under the effects of marijuana the next day, let alone 4 or 5 days later, where there still might be nanograms in your system. Marijuana can stay in your system for 30 days, 60 days, depending on your body type. Next slide, please. Okay. Now, luckily for many, many people in the state of Michigan, there is a slight out to this. Well, if you have a medical marijuana card and they do find marijuana in your system, they have to prove impairment now. Because they say, oh, okay, you have a prescription, you have a doctor's recommendation, and the state told you can use marijuana. Now, if they find marijuana in your system, they actually have to prove impairment as well. So this was decided in People v. Kuhn. They found that the strict liability of under the influence was inconsistent and therefore superseded the vehicle code, because that would basically say that, these, 40,000 people that have a marijuana card, that you basically couldn't drive, and that's why they said that it superseded. Next slide, please.